Anyone that wants to claim that ketogenic diets and fasting are curative for cancer is simply lying. Obesity is linked to 13 different cancer types that we know of.
What can you do to prevent cancer? In today's episode, you're going to find out. I'm Dr. Rena Malik, urologist and pelvic surgeon, and welcome back to the Rena Malik MD podcast, your source for evidence-based information about your sexual health and more. Today, our guest is Dr. Joseph Zundell, a PhD in cancer biology who's taken on the task of trying to educate the masses on Instagram about cancer. He calls himself Cancer Daddy. Today we had a wonderful conversation about everything cancer. We talked about his experience losing his mom to cancer and the aftermath of that. We also talked about what is cancer and what are the top 5 things you can do to prevent cancer. We discussed nutrition and fasting and sugar and all the questions that you have about cancer and how misinformation can do serious harm when it comes to treating cancer. There is value in this podcast for every single person because unfortunately, cancer is touching everyone's lives, whether it's your own cancer or someone you love. Unfortunately, many people are experiencing the challenges with it. Dr. Zundell, thank you so much for joining us. Cancer Daddy, we are happy to be in your presence.
Thank you so much for having me. I really appreciate it. It's an honor. You have a massive platform, so I'm kind of excited that you reached out for me.
Of course. Yeah. So for everyone listening, I mean, they've heard your intro, but you're a cancer biologist and everyone sort of chooses their life path in an interesting way. But yours, I understand that your mom had cancer. So tell me what that was like for you.
Well, as anybody will tell you of anybody, who's had a family member with cancer, dealing with it firsthand is really challenging. And it prompted me to get into cancer biology and study it for a living. But very basically, my mom got esophageal cancer, largely due to a misdiagnosis when I was about 15 years old or so. By the time that she was in a position where they actually could diagnose it, it was a little bit too late. And then, of course, with late stage or relatively late stage esophageal cancer, nonetheless, treatment options are quite limited. And they worked well for some time. She ended up fighting esophageal cancer for a little over 2 years, but eventually, with the medication and what cancer does to your body, she ended up succumbing to the disease when I was around 17. As a kid, it was really challenging to cope with, and it took me arguably up until now to be at peace with the things that happened during the time. But as a kid, it really made me quite angry seeing your hero, your mom, go through all those things. Like I said, it prompted me to get into cancer biology as a researcher. And now my whole goal is focused on utilizing the things that I've learned to provide solace and comfort to cancer patients, to know that it's a really complex disease, and also try and address a lot of the conspiracies out there, because it's a very complex disease, as most are, but there's a lot of oversimplification that can be quite damaging to cancer patients.
Absolutely. My mom had cancer. She had breast cancer when I was also in high school. Fortunately, she got through it. She's doing wonderfully well now.
Great.
But as a young person, the way you respond to a family member, and even the way your family member responds to having cancer, is so varied. So for me, I sort of, was just in my head optimistic, things would be fine, but I definitely didn't if something had not gone optimistically well, I would have regretted the way I dealt with it, because I sort of was like, okay, she's going to be fine. Everything's going to be fine, and dug my head in the sand. And I think it's really important to realize that we're going to talk about a lot of things about cancer prevention today, but spend time with your loved ones. And when you have cancer, yes, there's some things you can do to prevent it, but not always. And I think just going through it is a very unique and emotional and powerful scenario for you, yourself, your family, and everyone around you. And give yourself grace and try your best to realize that people who are caring for you are giving you the best information they possibly can.
Yeah. And I think it's also just very important to just try and be there for a cancer patient. Oftentimes, it's really just about trying to take care of the cancer patient, but nobody really knows what to do with their family member who is a cancer patient. So oftentimes it's really just about listening, just being a good support system, not really trying to give crazy nutrition advice or any sort of stuff like that, especially without appropriate guidance. I can't emphasize enough, just listen to them and give them what they need. Try and make sure that they can get to and fro from their doctor's appointments and those sorts of things. And just listen.
Yeah. You had some struggles after your mom passed away, which you shared on your social media, and some of those were pretty profound. Can you talk about those a little bit?
Yeah, so after my mom passed away, I knew I was on this track to go into school actually for a full ROTC scholarship program. I've always been interested in sciences, but everything just kind of fell through. My mom passed away. My scholarship was basically given to somebody else due to misallocation of funding. Go Army. Because of that, I couldn't afford my education. So I got a full scholarship to go to the school. I was thrown in the deep end, and then suddenly my money was stripped away. So I literally had nothing at the time. And so I had to transition from the school that I was at pursuing a degree in marine biology to then going to a different school that, my sister was at the time, where I needed to be around family because I was literally alone. And I went to a school called St. Leo University, and they didn't have marine biology. They just had a biology program. So I got really involved with the biology program, and I kind of used my education as a coping mechanism to acquire knowledge about what made my mom sick from a very foundational perspective. And I realized very quickly that it was, very complicated, that there's obviously a lot of things within her control as a smoker and those sorts of things. And even from a dietary perspective, but there's just a lot of things outside of her control. There was a lot of family struggle at the time. My stepdad basically abandoned me, so I couldn't really rely on him for anything at all. So it was just really hard to get through school and try and remain focused in my education. But I became so fixated on trying to find answers, again, from a foundational perspective of biology, that eventually led to me acquiring internships at the Moffitt Cancer Research Center, which is actually one place where my mom went in Tampa, Florida. And one thing just kept leading to another, and I kind of dropped the marine biology track and continued on a path of doing cancer biology 100% of the time, maybe 200% of the time, not sleeping, sometimes not eating, to just study. It was a bit crazy. I probably shouldn't have done that, but I became so addicted to finding answers to cope with that loss. And it progressed through my education to the point where eventually I got a PhD in the topic. And a lot of people think that, it's kind of a fake degree because it's like, oh, he has a PhD in cancer biology. Because I don't think it's a common degree title. Most degrees and PhDs are like molecular biology or biochemistry and biophysics. But mine was a specialized focus on cancer biology itself, which, comprises all of the molecular biology stuff and biochemistry and all that stuff. It was very challenging, but, it got me to where I am.
Yeah, I think it takes a little bit of obsession to get success to some degree, maybe not to the unhealthy degree that you were at, but I think it does take a little bit of commitment and obsession. And I'm sorry you went through all that. It certainly is not easy to be without the person that, is your rock and your stability during that time in your life. So clearly you've spent a lot of time researching this. You've obviously gotten a PhD, which is a very difficult degree to get for those people who don't realize, like, it is a huge commitment. You deliver a thesis. I mean, there is a lot of work that goes into it. And then on top of it, you obviously have done a lot of your own research fueled by the loss of your mom. So let's start with just kind of educating the audience. What is cancer?
Yeah, so the way that I like to simplify this for most people is that cancer is a disease categorized and characterized by cells just continuing to grow past what is considered normal, because our cells within our bodies, they have a finite limit of the amount of times that they can divide carefully. And there's all these checkpoints and balances that enable cells to divide in a very controlled way such that you don't develop cancers. But cancers arise when there's issues within these checkpoints that enable cells to continue dividing past a lot of these checks and balances that normally keep them in check. So that's the simplest definition of cancer that I can possibly provide. But all the things that govern these loss of checkpoints, they're not only from a DNA regulation perspective regarding mutations, they can also be from environmental stimulus to either induce mutations or induce like epigenetic modifiers that can make a cell somehow skip past these regulatory things without mutation. There's also immunoregulatory components of how our immune system can check for damaged cells or weird looking cells in our bodies. And all these things are blankets for these variety of different mechanisms called the hallmarks of cancers. So those are the mechanistic underpinnings from the cancer biology perspective.
Yeah, so it's very complex. It can be DNA damage, it can be epigenetic changes, it can be damage to the immune system regulation. So lots of different things. People often sort of summarize it or identify the causes that require cancer to develop as a two-hit hypothesis. Can you explain what that is?
Something I've actually posted on about quite a bit, and a two-hit hypothesis. It's essentially that you can either have a single genetic event plus a spontaneous event or another genetic event to initiate tumor development. And now it doesn't always need to happen. More often than not, it's like a snowball effect of multiple events, sometimes originating from one event, depending on how severe it is, whether it's spontaneous or a genetic mutation. But in general, based on all of the evidence that we've seen, it in general takes more than one event to initiate tumor development. Whether or not that first event potentiates other scenarios to create more events on top of that first event to initiate tumor development, or if it's, multiple events from different angles, whether it's like a epigenetic spontaneous thing, whether maybe someone's exposed to radon, as an example, is the number one cause of lung cancer. And they also maybe have KRAS mutation because they smoked a cigarette over time, and cigarette smoke being a mutagen induced KRAS mutation in some areas in the lung. So radon from another source plus KRAS mutation, potentially from cigarette smoke, those things can predispose someone for cancer. But in a lot of cases, either event alone isn't sufficient to induce something like lung cancer or any other cancer. But just because there's context doesn't mean that it's always necessary for those things to happen.
Are you sick of going to the doctor only to have them talk at you for 15 minutes and leave without knowing exactly why they're prescribing you this certain medication and what exactly the next step is to take to optimize your health? Wouldn't it be great to finally find a doctor who actually listens to you, answers your questions, and doesn't rush you out the door? Well, at my practice, Rena Malik, MD, I aim to do just that. I specialize in taking care of patients who have issues with their sex lives, issues with their bladder, with their hormone health, or are having pain in their pelvic region or with sex. My goal is to give you the time and attention you deserve so you can leave with a clear understanding of your condition as well as our treatment plan that's optimized for your goals. During your visit, I'm 100% present with you for an entire hour. And after you leave, you can reach me. It is super easy to send me a message through our secure portal, and I'll get back to you within 24 to 48 hours. No questions asked, no hidden fees. Scheduling is easy. Just visit our website, renamalikmd.com/appointments. We see patients in both Irvine and Beverly Hills, California, and I see patients virtually in California, Florida, Illinois, Maryland, New York, New Jersey, and Virginia. Oh, and don't forget Texas. If you're outside these states, consider seeing me for an educational visit. I look forward to seeing you. So then how much of these two hits are often due to preventable causes? Like how much of it is really preventable?
It's tricky because I would say most of cancers are preventable. But the problem with that is we don't always have privilege in our society to do the necessary things to prevent certain cancers from arising. So if I live in a third world country, or I live in a relatively poor area of the United States even, and my access to appropriate education for one and healthy foods is not high, and I'm in an environment where there's maybe a lot of pollution, there's only so much I can realistically do there. So while those are preventable things because I can remove myself from that situation, my ability to remove myself from that situation may not be there, and kind of forces you to interact with mutagens and carcinogens that you can't physically remove yourself from because of socioeconomic status. Again, simply while cancer is a preventable disease for all intents and purposes, doesn't mean that everyone can do what they need to do to prevent it. Does that make sense?
Yeah, and I think it's so important that you brought that up. I think a lot of people, especially on social media, they'll focus on specific ingredients, specific food dyes. I saw one of your posts today, I think, actually on food dyes, and very minutia things that, yes, yes, they're problematic. But like, I think on a bigger scale, if we focused on improving the quality of education, the food availability and food deserts in our country, we would see significant improvement in health overall, right? I think that that is something that is so important to discuss. And it's not sexy to talk about on social media, right? Like,
Nope. I mean,
so
you see my
unfortunately, it
posts,
just,
right?
yeah, it just
They don't get
doesn't
a
get
lot of
the
clicks.
attention. Yeah.
Yeah.
So, what are the top 5 things that someone could do within their power to prevent cancer? And we can talk about people if they had an unlimited supply of resources versus those who maybe don't.
I'll say this from something that everybody can do. And of course, this comes with educating ourselves too. So actually, I wrote a newsletter on this. So when people sign up for my newsletter, it's the first thing they receive is my top 5 cancer risk reduction tips. The first thing that I would say is consistent and safe exercise. Doing whatever it is that you want to do for the entirety of your life, adapting whatever exercise you like to do over time as you get older. Just being consistent about it. Doesn't matter what it is. Do it safely. Try to reduce prevalence of injury where you can. Consistent exercise can't get any more important than that in terms of cancer risk reduction. But that'll also reduce a variety of different disease risks, let alone cancer. That's super important. Another one is sleep health. There's really strong causative data now to show that dysregulated sleep can be carcinogenic in a way. By destabilizing a lot of the metabolism that governs how our organs work together to metabolize foods and our response to light and those sorts of things. And this is circadian biology. So if we chronically are poorly sleeping, it can significantly increase our risks for cancer. So adopting healthy sleep behaviors is incredibly important. So like going to sleep with comfortable bedding, ensuring that the room is as dark as possible, going to bed at an appropriate time frame in accordance to human physiology, trying to get 7 to 8 hours at actual night and not, unfortunately, like shift workers, as an example. Shift workers don't always have that privilege, but, trying to sleep in accordance to human physiology, those sorts of things, just, ensuring you're comfortable while you sleep. Another one is practicing sun safety. Sunlight, of course, is very important from a circadian biology perspective, but sunlight is many different spectrums of photons and sometimes radiation. So radiation and photons are kind of the same thing. People often don't get that difference, but as a part of sunlight, you have ultraviolet radiation. Now, while it's not non-ionizing and while it can't maybe damage you as much as X-ray radiation or gamma radiation or maybe even like alpha particle decay if you want to get really fancy. Practicing sun safety from ultraviolet B rays by wearing sunscreen. If I'm somebody who works outside often, wearing sunscreen can be incredibly important. If you don't want to wear sunscreen, you can wear appropriate SPF related clothing, but in general, sunscreens are pretty safe. But it's always, these contexts about how to use these things and not over applying them to, use them the way that they're intended to be safe. Minimizing smoke and alcohol consumption. Obviously, smoking is a carcinogen, the same as alcohol consumption is a carcinogen. Now, people get a little bit triggered when I say minimize because I don't believe in the cold turkey approach from a human behavior perspective. I would love it in the world if nobody smoked or drank because it would be great for everybody in the long run. However, as somebody who is a human being on this planet Earth, I also enjoy the occasional alcoholic drink. And I'm not going to lie to you, I've smoked the occasional cigarette or marijuana occasionally. I don't currently do those things, but I still drink the occasional drink now and again. But they are carcinogens, so minimizing the exposure to those things as much as possible is going to have positive health effects. And if you can not do them at all, great. But some people, like myself, like the occasional drink. And of course, overconsumption of those things comes with significantly increased risks. That is a fact. Consuming a nutrient-rich and diverse profile is what I often tell people as well. So this is, again, in accordance to human physiology, consuming a diet that has a lot of diverse types of vegetables and a lot of diverse types of protein sources. A lot of people get so fixated on, I need more protein, but they assume that, meat is a really good source of protein. And it is a really good source of protein, but you can also get protein from plants. Instead of fixating on protein in a person's diet, both plant and animal sources of protein have so much more than just protein that have really good things for our health. And consuming one food group versus the other, whether it's meat or plant-based products, can come with negative side effects. So we really need to consume a diverse and nutrient-rich profile, so we can get the fiber and the vitamins and the minerals that come from plants, and the different types of fats and different types of proteins and things that comes from meats. Again, diverse types of meats, like omega-3s are prominent in salmon and those sorts of things. Beef has good source of iron for our health, a lot more than plants in many cases, and in some cases, in many more bioavailable. Those are the things that can help a person be healthy regarding their diet. The way that I like to talk about our immune system is that our skeletal muscle is mechanistically linked to how our immune system works. So the way that our heart pumps our blood through our bodies, our lymphatic system doesn't have a heart to pump the fluid throughout our bodies, and our lymphatic system contains our immune cells. And so our skeletal muscle contractions drive that. Now, even not exercising, our skeletal muscles contracting will drive lymphatic fluid movement. But obviously, the more I exercise, the more I maintain a healthy exercise program, the greater lymphatic fluid movement I'll have, and the increased likelihood I'll have for my immune system to function healthy for my body. So that's how the immune system is intrinsically linked to healthy skeletal muscle function. So that's why it's really important for people to exercise just from an immune cell perspective. But there's immune independent mechanisms about how exercise can secrete these proteins from muscle tissue to enable our organs to work together in harmony. So this is called myokines. So when we exercise, our muscles secrete myokines, and they go throughout our blood. They interact with, liver cells and kidney, and they kind of tell everything to work together. So that way we respond from an energetics perspective to shuttle glucose and fats throughout our bodies, and they can go to tissues as need be. And exercise helps to stimulate that as well from a metabolic perspective.
Great. In terms of nutrition, I think you mentioned some great points that people often get very nervous about. One is, like, a lot of people are taking on the carnivore diet, which means that they are not having any fiber in their diet really at all. And so I, as a physician practicing clinician, know that there are strong links with fiber consumption and reduction of colorectal cancer, and certainly a lot of benefits from cruciferous vegetables, from vegetables in general, right? Getting flavonoids and other antioxidants that can be beneficial for a variety of things. What is the pushback against vegetables and fiber?
I honestly, I don't know. I think there's this level of extremism that I'll never understand on social media, just because, and this isn't a jab at anybody in particular, but I think way too much, and I try and bolster my audience to think more critically about these problems, because if we live in extremist camps, it becomes very easy, but with these extreme behavioral tendencies, you can have problems. With vegans and vegetarians and carnivores, they often live in these extremist camps and try and ignore things like fiber in their diet from a carnivore perspective. And it's just not in support of the evidence that we have at our disposal. So it's a real problem, because then we see, people who have overall increased consumption of red meats in their diet relative to plants. So like somebody who consumes primarily red meat in their diet and zero plants, if any, they'll have severe health issues, not even just from a fiber perspective, but just because they're not getting a lot of the vitamins and minerals that come with plants and those sorts of things. I wish I knew why people attached to these camps, and I guess I'm kind of happy that I don't. But again, people don't like to consider how complex these things are. They would just rather be told carnivore diet's the best, veganism's the best, vegetarian's the best. But more often than not, it's somewhere in the middle, and it's often dependent on a person's lifestyle too. There are many cultures, as you might be familiar, that are primarily carnivore or primarily vegetarian. And there's trade-offs that come with those decisions. But, sometimes there are societal limitations as to what diets people can do. But, we live in the United States, which is, a pretty well-developed country. I'd like to think a lot of people have access to, diverse food sources independent of, the amount of ultra-processed foods in their environment. They can still, if educated appropriately, consume a nutrient-rich diet, even if that means consuming ultra-processed foods. So that, like you mentioned with my video too, it's like people love to live in these camps where they just demonize cereals and dyes like Red 40, but realistically, someone shouldn't be eating so much of those cereals in their diet that it's going to cause them severe health problems. But they can be incorporated and often enjoyed into a person's diet. They just shouldn't be sought after for nutritional reasons.
Absolutely. There's a lot of fear around sugar and cancer, that sugar feeds cancer cells, and fasting on the converse, cures cancer cells or starves them of their nutrients to then make them shrink. Let's talk about that.
This is one of those issues in my field that I'll never be able to escape, no matter how much it frustrates me. Because the truth of the matter is that glucose does fuel cancer cells, but so too does it fuel a majority of the other cells in your body and organs and tissues. It's just the way that cancer cells utilize glucose is different metabolically, largely. So trying to give people the appropriate nuance as to how they're utilizing glucose differently than normal healthy cells and how that creates problems in the case of cancer is a very challenging and complex thing to discuss that most do not want to sit down and spend the time to understand, although I try. And I do my best to try and keep it simple for people. But the truth of the matter is that it's not simple. These are complex metabolic and biochemical pathways within our cells, depending on where they are in our body, that compete for not only glucose, but other sources of fuel like amino acids. And we even see cancer cells utilize amino acids as materials to enter into different biochemical pathways. But that doesn't mean that all cancer cells all the time utilize glucose either. So there's a lot of adaptations that happen within cancers, and especially as they're developing. If you starve them of glucose, they can adopt different ways to use different fuel sources. I think people fail to realize often that life is very adaptive, and cancer cells at some point had all the materials that a normal healthy cell had, but they just kind of became so messed up that now they kind of evolved into something different within you. And so it's a little bit more of a parasitic relationship than it is, you fighting you anymore. And it's, like I said, it's very complicated. So there's a lot of ongoing clinical trials to investigate how starving and various diets like fasting and ketogenic diets can be helpful for cancer patients. But without understanding the consequences and the context of these situations, we can't know how to implement these dietary strategies safely for cancer patients. So while they might help reduce a person's cancer, we have to understand all the ways that it can help somebody, identifying that it has more pros than it does cons. And right now, there just isn't enough information. So anyone that wants to claim that ketogenic diets and fasting are curative for cancer is simply lying.
Quick break from this episode to let you know I am so grateful that you're spending part of your day with me. I started creating content online to empower people to learn more about their bodies without needing to go see a doctor, pay a copay, wait in a waiting room, or find parking. And it has been one of the most rewarding experiences of my life. If you want to help support our mission of providing free education, please consider joining our premium membership. There you will have access to ad-free episodes, which are released early, as well as free transcripts and the opportunity to ask me anything. And these questions are answered in our monthly AMA episodes. Support the show and join today at renamalik.supercast.com. Can't wait to see you there. Do you think there's value in terms of prevention with fasting? You hear about people doing 5-day fasting mimicking diets or 5-day or prolonged fasts, like once a quarter or whatever, once a year. Is there any value to that in the literature?
A lot of it comes from, and Lane Norton, my friend, he speaks about this quite often regarding caloric intake. So if somebody really is trying to lose weight, as an example, obviously obesity is linked to 13 different cancer types at this point. That we know of, which, is obviously too many. If somebody is obese and they're trying to lose weight and they really latch on to these fasting diets and they're able to lose weight through those, the pros outweigh the cons. But again, there are unhealthy ways to go about doing these fasting and ketogenic diets and stuff. Oftentimes, they're not easy to maintain. So they can be good in the short term for weight loss, but overall, in the long term, they're not great for good human health outcomes. It doesn't mean that somebody can't do it, and I'm sure somebody will argue with me if you show this clip, claiming that I'm an idiot or something. I don't know anything about nutrition or whatever, but these diets, they can be helpful. But again, without understanding the context, it's just a diet. So they can be helpful for people to reduce weight, but that's pretty much it.
But not cancer prevention.
In doing so, that can help reduce someone's cancer risks if it's directly linked to obesity, but intrinsically, no, they're not going to be directly reducing cancer rates.
Yeah, because you'll hear people say things like, "Oh, I fasted; it killed all these precancerous cells in my body because I fasted." And
Yeah, it's absurd.
so yeah,
I mean,
yeah,
the thing here that people need to realize too is that cancer isn't just one disease, right? So if I do this diet, and there's research to show that like fasting diets reduce colorectal cancer risks, right? I don't know if that's true, so don't quote me on that, because it's, again, not my full area of research. But let's say there's a study that says fasting mimicking diets reduce prevalence of colorectal cancer. But what about all the other cancers, right? So there could be positive relationships between how fasting can be related to other types of cancers and simultaneously reduce colorectal cancer risk.
yeah, absolutely. So what about artificial sweeteners? I feel like there was some major articles last year that really put a lot of doubt in people's mind about artificial sweeteners and how they're going to cause cancer. And the data was, pretty convincing in an isolation that there is harm related to them.
Yeah, no, I get asked this quite a bit too. It's again tricky because you can find any study online, and this isn't to say that this study wasn't important. It was well done to most degrees, but you can find any paper online that links any sort of anything to cancer risks. And the truth of the matter is that aspartame does have some risks for cancers, but realistically, most people aren't going to consume or shouldn't be consuming that much aspartame that it's remotely close to increasing their cancer risks. So that degree of variability in humans is very wild regarding how aspartame can induce or increase risks for cancers. But overall, I would say that it's not going to impact most people, especially, again, if people are using zero-calorie beverages, as I often do as well, to try and regulate caloric intake to maintain a specific weight or engage in actually healthy behaviors. So in general, with people who are using this tool appropriately, because it is a tool, people who are using it appropriately, the pros outweigh the cons vastly, even if there is some minor risk.
And then how much is too much, would you say? If the average person was like, I drink 2 cans of soda every day, or, diet soda specifically.
Again, it depends on like the diet soda, but if it's like, Diet Coke, which I think has like acesulfame in it, or sucralose or aspartame, one of those containing beverages, I would say 20 a day. But I would assume it's realistically it's much more than that. Realistically, the studies in mice, which has some translatability, not amazingly, in mice, these studies, you'd need to consume hundreds of cans of Diet Coke a day for significantly increased risks. But I would say anybody who's consuming 20 of these cans per day of Diet Coke or whatever probably doesn't have their other ducks in a row regarding their nutrition either, if they're relying on that many drinks. And then there's also the component of excessive caffeine consumption along with these things too. So if I increase my caffeine consumption and it negatively affects my sleep health, that's going to impact a person more than consuming 20 Diet Cokes a day and the aspartame. You know what I'm saying?
And they'll be in my office as a urologist because they'll be peeing all the time.
Yeah.
All right, let's talk about carcinogens. So there's class 1 carcinogens. There's group 1, group 2, group 3, group 4. Group 1 is essentially carcinogenic to humans, which include things like smoking, alcohol, things that are indisputable. And I would argue, and again, you can correct me if I'm wrong, that there is some data to suggest any amount of alcohol increases your risk to some degree, maybe not a lot, but some, right? Is that correct?
Yes, that's correct.
Okay. Even hormone replacement therapy ends up in that category, particularly estrogen, which is interesting to me, but it is on the list. And then group 2 is probably or possibly carcinogenic. And this is where all these things come in. There were some things that surprised me on this list. So red meat's on this list, which I knew about. Very hot beverages, night shift work. These are all probable carcinogens. I guess night shift work makes sense because of the sleep dysregulation. I did not know about the very hot beverages. And how do you define very hot, right?
That's really interesting. I imagine that's a weak correlation at best. And obviously the definition of very hot is obviously ambiguous. I would assume that has something to do with a behavioral correlation between people who drink very hot beverages, whether it be like, again, excessive coffee consumption. Maybe, people who typically drink coffee, they drink it very hot, which certainly might be true if you're Italian. People who grew up in Italy, they drink coffee more than most cultures. Cultures Chinese people, where tea, Indian people as well, where tea is an integral part of culture, maybe even in the UK. Again, excess caffeine consumption with tea. There's also positive relationships between certain types of teas. Like green tea has EGCG in it, which has some positive effects on cancer risk reduction. But again, I wager that correlation there is largely due to poor behaviors that come with drinking these hot beverages, and not directly because of them. So causation and correlation.
Yeah, I do recall, I think, and if anyone is listening who is an expert in this area, please comment that very hot temperatures, I think it's the way they affect the esophageal lining, perhaps. I'm not sure, but that may be part of it. I don't know.
I don't know. I'd be surprised, especially given that, I don't know, I would just be very surprised if we found that was a variable in terms of inducing mutagenesis or something like that. I could see that being the case with maybe the hot beverages are burned, or in heating, you're producing some sort of low amount of carcinogens such that if I can consume a lot of it over time, maybe. And that's certainly true with, grilled meats as an example, or obviously smoking cigarettes or inhaling combustible material. Perhaps it could be a link there.
And then red meat, I know, is very contentious. The data is there that supports it. However, a lot of red meats are high in saturated fats, which then also increase weight and then put you at higher risk. Anything to add on that point?
So from what we know about red meat as well is it's most of the time because of how people cook red meats, and even chickens. If you grill any sort of red meat, or any sort of protein for that matter, even plants, if you grill it under high heat, you're going to induce the formation of carcinogens on the surface of the meat, while simultaneously creating that nice Maillard reaction, the crispiness of the protein on the surface of the meat that, provides that nice mouthfeel when you have a good steak or grilled chicken or something like that, or salmon. But it produces these carcinogens called polyaromatic hydrocarbons and heterocyclic amines, which, obviously if you consume enough of those in terms of grilled meat consumption, they're carcinogens. So there's a pretty causative link there in association with those. But as you point out, it's also about we're consuming these red meats as a total component of our overall nutrition. If somebody is consuming primarily beef and red meat, and they're grilling it all the time, and they're not consuming veggies, and they're not paying attention to other components or dairy in their diet or breads or any of those other things, and it's mostly just meats, particularly red meats, that's where we see the health effects.
I just reviewed this study on the dietary inflammatory index, and it's an index which has pro-inflammatory foods and anti-inflammatory foods, but it takes in the totality of your diet, right? So if you're having red meat more than twice a week, then it becomes, you get a point. That's positive. But then if you're eating a certain number of servings of vegetables, you reduce a point. So I think, again, taking in the totality of your diet as a whole is really important.
A lot of this inflammatory stuff can be quite confusing, arguably inflammatory. I think people don't understand this because it's very confusing. Inflammation in our body is very diverse and a necessary thing. Like right now, you and I are both experiencing some degree of inflammation. It's the type of inflammatory responses that matter, and how strong and often these types of responses matter. So trying to categorize things based on an inflammatory index, if we don't understand what those inflammatory responses are, can be very confusing to most people. And I'm actually not an immunologist. I understand enough about immunology through my training, because it is an integral part of my training. But I try and convey this to people that, inflammatory responses are both good and bad. It's the type of inflammatory responses we need to understand in relation to not only our foods, but everything in our environments that can affect our health.
It's not an all or nothing. Yeah. Not all inflammation is bad. Absolutely. And right. I think people will often say, well, that's inflammatory. It's bad for you. And not necessarily, right? We need, our body's response to inflammation is actually a good thing in terms of evolution and a whole host of other things. The group 2B, and you can look all these up on the CDC website, possibly carcinogenic, included some interesting things too. Ginkgo biloba, which a lot of people use for erectile function, which I don't think works that well, I'll be honest. Kava extract and aloe vera. So I was sort of surprised. A lot of people use these things pretty regularly. Again, these lists, I think, can create a lot of fear. And you look at them and there's a million compounds on there that, in large quantities would absolutely be carcinogenic, but you might find exposure to them everywhere. And so I think it's...
The aloe vera thing is kind of funny to me though too, is because one of the first things that comes to mind with aloe vera is to treat sunburn. And so if somebody is chronically getting sunburn and they're applying aloe vera on their skin, it's often very hard to mechanistically dissociate the two in literature and say that it's the aloe vera and not the fact that this person is chronically sunburnt, right? So
Absolutely.
I think that's something people need to understand too, is that it's really hard with these epidemiological studies to parse apart actual causation from things like aloe vera or even ginkgo biloba. I'm not sure. I've seen it on the lists, but some of these things shock me too.
Yeah. And I think, again, the important part here is like a lot of these come from causation correlation studies. No one is randomizing people for, the amount of time it takes to develop a cancer, right? No one's randomizing people for 10, 20 years on one thing or not. And then seeing, yes, this is definitely causing and controlling for everything else, right? Like you can't literally control for everything else. And so I think to take these lists with a grain of salt, but obviously there are some things where the ratio of risk is so high that we're pretty certain, like smoking causes lung cancer. Mm-hmm. We can pretty definitively say that. Whereas other things, maybe not so much.
Yeah. So, it always depends on the level of evidence to support something. And that's what gets something between different classes of carcinogens. At some point, cigarette smoking was a class 3B or whatever the hell the designation is there for carcinogens on the WHO website or even the IARC. But, with more evidence, you can move those things up and determine how causative those things are for cancers.
Absolutely. So what do you think about when you hear stories where somebody maybe reversed their cancer by doing XYZ on some diet or some supplement routine? They didn't have any sort of traditional Western medicine. What are your thoughts on that? Do you think that is actually true, or do you think that there's more to it?
Of course, I think there's more to it. I think online it's very easy to show positive outcomes from people who only have incentive to show positive outcomes. Now, it doesn't mean that this stuff can't happen. It doesn't mean that spontaneous remission can't happen in somebody that does have cancer. But usually in these reports, you're only seeing much less than 1% of the total picture. Oftentimes, we don't even know if this person had cancer. And I'm not saying that they don't, but in a lot of these reports, you don't even know the type of cancer. We don't know the staging. Sometimes people go to these obscure clinics out in Mexico or some random place in the world, and they get quote unquote diagnosed by somebody that they have cancer, and they probably don't. And then they get them on the supplement protocol. They tell them to go do like ozone therapy and these other things, and they keto diets. And my dad went to Jamaica, and he said, because he recently had melanoma on his nose, because it runs in the family. We've got a lot of moles in our family, and it's just a risk factor. Somebody there told him, eat a bunch of sour sop every day and do this detox, and immediately those things frustrate me. And again, it's not to say that you can't have spontaneous remission by doing these things, but they're just not usually well supported. Again, it's not that I don't want to believe them. It's that there's not evidence to make me strongly believe in them. That's my job as a scientist, is to use what I know and the things that I test to be able to determine how truthful something is. And if there isn't enough of that, then I'm still left with an I don't know at the end of the day. And now, while this might make my life very confusing and arguably give me trust issues in many ways, the things that I do know, it gives me a lot of confidence in. I'm just happy with saying I don't know to those things, whereas a lot of people will go online and push out this information. And the upsetting thing for me about that is it might dissuade somebody who actually does have cancer from getting treatment that they actually need that will significantly help them. It might not be optimal, because obviously with therapeutics, there's cons associated with it. But the idea is that with these treatments, the pros far outweigh the cons in specifically targeting that person's cancer. But if they forego their therapy because they, went to Jamaica and this guy was like, oh, take soursop, that'll take care of it. Take vitamin D. How about this NAD supplement that, Dr. Sinclair always talks about online because it affects metabolic flux and a bunch of jargon and somebody sounds smart online. Next thing you know, that person's disease is getting worse and worse, and a lot of people die. But we don't see those online because they don't have to legally report deaths of patients. They only have to, report the positive outcomes. And the positive outcomes usually from those people are arbitrary because they're not capable of assessing positive outcomes in the first place. I know that was a long-winded response, but that's the nature of this situation. It's tricky.
It is, absolutely. Have you had some stories where people did something that they thought was going to help cure their cancer and they ultimately got worse or maybe even died because of misinformation they heard online or saw? Or
I see it far too often. A lot of people. I can count the numbers on more than two hands. People approach me every day too. They message me on social media too. And, my grandmother has cancer, my mom has cancer, my brother has cancer. And so-and-so. I read in Dr. Stephen Gundry's book that, you can do this and prevent cancer. And, if you don't give people the appropriate specifics behind these things, it can be very misleading. Often it just makes their cancer worse. And a lot of the times for me, it's about preserving the integrity of life, because oftentimes if somebody does have cancer, depending on how late stage it is, it's often about improving quality of life where possible. So that they can live the longest with their condition. They still might die from cancer, but I often have to think about the things that I can realistically tell these people such that they don't listen to the quacky advice out there, because it's far too common, and that they integrate the things that have sufficient backing into their lives to improve their quality of life, such that if they do at the end of the day die of cancer, their life was prolonged because they implemented evidence and not, for lack of a better word, quackery.
I think as a clinician, it's really important to, when you receive a diagnosis of cancer, is to have a discussion about how long is this treatment going to prolong my life versus if I did nothing, and what will my quality of life look like? Because I think a lot of times, and in studies, and we review studies all the time, in prostate cancer, is probably the most robust in urology, where we're doing a lot of research. And you'll see there'll be an improvement in overall survival, but it may be on the order of months to a year. And I think it really depends on, and then there are side effects, of course. So I think it's important to have those discussions, not to say that you should always forego treatment, but maybe that's right for you, right? And maybe it's not. But I think you should be educated and ask those questions, because those we can give you data on. But I can't give you data on your sour sap, like how long is it going to prolong your life, and what's going to happen if you take it or not take it, right? I think that's why people sometimes feel frustrated, because there's no free lunch here. Like, you got to decide longer life with maybe some side effects, shorter life with worse, metastasizing cancer. Those are tough decisions to make.
Yeah, and it's a really hard discussion to have too, because cancer outcomes, even if two people have the same exact cancer outcomes are very variable between people. So even if two people have the same esophageal cancer at the same exact stage, one might respond to treatment, whereas the other may not respond at all. And there's still a lot of details that we're still trying to understand as cancer biologists as to why that can happen. But that level of variability doesn't usually translate well to giving somebody a prognosis. And oftentimes doctors will err on the side of caution and give you a lesser time frame rather than a longer time frame. Just because that's just the safest bet. But that can be pretty crappy to hear as a cancer patient. And so I try and temper a lot of people's emotions regarding prognoses. But it's also, as you point out, with quality of life, if somebody does have cancer, or any disease for that matter, and they go through a certain treatment for a period of time, and they have refractory disease, as in the case of cancer, their cancer goes away because of one treatment, but then it comes back, which is, basically a different disease at that point. It's not even the same cancer, because it's evolved in such a way that now the first treatment won't work. And this is typically what we call as chemo resistance or refractory disease. Sometimes, depending on that person's lifestyle, you might have to make the tough decision that, depending on their age, their quality of life, maybe not having treatment and just living out the rest of your days as happily as possible with your family is going to be better than being on a drug that doesn't have the highest likelihood of success because your cancer is refractory. And that's a really sad and tough discussion to have. And, we had that with my mom when I was young. And for me as a 17-year-old, it's a really hard discussion to have, but no matter your age, it's not easy. So really it's all about preserving quality of life where we can.
Are you feeling in a rut in the bedroom, wishing you had the kind of sex life you could brag about? I've spent years helping patients and creating content for people all around the world to improve and optimize their sex life. Today, you can get my knowledge for 100% free with my new ebook called Better Sex, Better Life. In this ebook, I review my top 10 tips for improving your sex life, all from the comfort of your own home. All you have to do is go to renamalikmd.com/morepleasure to download it for free today. So, what are some of the most harmful myths that you think have gained a lot of traction in terms of cancer?
One of the most harmful ones for me is I think this idea that we all have cancer cells inside of us, because it gives everyone this idea that they literally always have cancer that they're fighting off. But as I explained at the beginning of the video, when you asked me what cancer was, the difference between our body's ability to keep us healthy and prevent cancer cells from growing is very, very different than having actual cancer cells inside of us. So our body just naturally, through evolution, has a variety of different and beautiful mechanisms to keep us healthy, whether it's from, our immune system perspective, or if it's like specific mechanistic perspectives about DNA, repair enzymes and checkpoint proteins that maintain cell division in a regulated way, or even about, how our cells go about dying. That's even a very tightly regulated process. But our ability to regulate cell division and death isn't us fighting off cancer. Cancer happens, like I said at the beginning, when our body can't do those things anymore or loses those ability to do those things. We're not always fighting that off. And I think people have trouble parsing apart the difference of normal cell biology, just doing normal cell biology stuff as we get older, between cancer cells, which essentially is not normal. It's not normal cell biology anymore. Because if it was normal, it wouldn't be cancer. That one can be tricky because it leads people to believe that they all have cancer, and then they go on these missions to find supplements to reduce cancer, and they start getting into these weird wellness camps of people doing like ozone therapy and a lot of useless things. And then if they ever do get sick, they didn't spend the time educating themselves in an appropriate way. They assume that biology is some sort of binary box of zeros and ones that they can just take a supplement and shut off a pathway and cancer's gone, or take a supplement and pop on a pathway and then cancer's gone. It's nothing in life is that simple. And that's actually a really good thing, because that drives evolution in many ways. It's sad because for me, I love learning about biology. It's so beautiful how regulated things are inside of our cells. And at the same time, it's still kind of beautiful about how messed up it can be in diseases. I mean, how adaptive cells can be in kind of messed up environments. It's kind of a testament to life in a way. And to see people gloss over these details because, they place their trust in people online to have these answers, to gloss over these details, that's the upsetting part to me, I think. That's the harmful part, because people really just need to accept the fact that it's extremely complicated stuff. And in understanding those complexities, you can appreciate just how incredible. I don't mean to sound like a huge nerd here, but the existence of life is truly against the odds. It's incredible. And I need people to understand how complex and beautiful it is. And once they do, they'll know exactly who to avoid. They'll know exactly what to do given their environment, how to be healthy. There's a lot of crap out there, right? And it's hard to parse about who's telling the truth and who's lying to you, because it is complicated. The simplest answer, despite Occam's razor, is usually the solution. But when it comes to cell biology at a certain scale, the simplest answer is usually not the solution.
Yeah, science has come a long way, even since I started training as a medical student, in terms of researching cancer. And I think, we have a long way to go. But I think people, at least in the United States, we invest so much money into cancer research, and it's a priority. We want to save people's lives. And I think that I wish that we put some of that money into some more quality of life research as well, because I think those things plague people quite a bit. But, I hope that people feel comforted that there is a lot ongoing to try to improve people's life after cancer diagnosis and help them live longer.
Yeah, if you look at the statistics regarding even breast cancer, even 20, 30 years ago, we've come an incredibly long way regarding our research on not even just breast cancer, many, many different types of cancers. And we've developed a significant amount of different treatments, whether it's, small molecule chemotherapeutics, but now more so than ever, the emergence of immunotherapies in the immunotherapy space has amazingly increased a person's ability to live with cancer and treat cancers. So we've just come a long way. Nowadays, like breast cancer has a blanket statement, has a 95% 5-year survival rate. It wasn't always like that, but now with the because of research, because we've pumped so much money into breast cancer research being, it's the most prevalent cancer in the world next to lung cancer. Both of those have different, very, very different mortality rates, but that's a different problem where I think needs more funding. But breast cancers are 95% 5-year survival. We need to push more funding into things like lung cancer to increase the 5-year survival rate there. But it's a different argument for a different cancer. So the mechanisms of action for developing treatments are going to be very different than that of breast cancers. So people need to know that we've come a long way.
Is there anything else you want our audience to take away from you and your research and what you know about cancer? What are some things that you really want people to take away from this?
I've said this often on a variety of different platforms. I've said this even here. I need people to, if they're curious about this stuff, if they really want to learn it, they need to recognize that it's very, very complicated, and they need to devote the time to understanding it sufficiently such that they can make appropriate conclusions and even then appropriate statements about the things that they're curious about. So when it comes to cancer biology, it's a field of study that requires a significant amount of understanding, not even in just cancer, and I'm going to make a post on this soon, actually, and not to toot my own horn here, but I needed to learn a lot of different things to be able to be an effective cancer biologist. I needed to understand microbiology. I needed to understand, how bacteria and viruses in the environment can be related to some cancers, and even just how they evolve in specific ecosystems. I needed to understand mycology. I've taken courses to understand how different types of fungi grow and thrive in different environments, nonetheless on your skin, and how they can be beneficial for our health. And in doing so, I've also taken immunology courses to understand how we respond to pathogens like viruses and bacteria and how those change in diseases like cancers. I've taken physiology classes to understand, how blood flow works between the heart and those sorts of things. I've taken ecology to understand how humans being a part of this world interact with ecosystems and how that can shape not only our survival, but other species' survival, because we're not alone on this planet. So people need to realize that in order to understand cancer biology, you need to understand as many facets of life as possible, because all of those things that govern cancer cell biology require that you understand all of those things. I'm not a savant. I don't understand all of those things maybe to the degree of a complete genius, but I understand enough to know when I don't know something and when to ask the appropriate questions to find answers. And so what people need to get here is a really important level of patience and critical thinking to understand this. And without that, they're not going to. That's just, like we said when I first started this, my PhD track was a significant level of effort, and maybe certain periods of time during my educational track, it was unhealthy because of behaviors that I felt I needed to get my education. I would do it the same way over and over again, just because, in my opinion, it was a need, despite, some short or acute poor behaviors in acquiring my education. So that's what I think is the most important, because in learning those things, people can spot bullshit online.
I think the other thing is, when you or your family has a diagnosis of cancer, you're very vulnerable, right? And you want to believe the simple solution. You want to believe that there's something out there that your doctor didn't tell you that's going to fix you, that's going to cure you, because there's hope and optimism in that. And everybody wants that, right? So, I wish anyone who's listening or watching, if you are struggling with cancer or your family is, take the time to try to educate yourself, because it's important to learn as much as you can. Ask questions of your doctor, read up as much as possible, find people who are experts, who've done the training, who can explain things to you in a simple way. There are good things about the internet, right? You can find high quality educational content online if you know where to look. And that may take a little searching, but you can find it.
And that's what I tell people I'm here for, right? So again, I'm no savant. I'll tell you when I don't know something, but I need people to realize that I'm here to try and fill in those knowledge gaps where I'm able. And if I don't know something, I'll point people in the direction of somebody that does, or give them a resource that helps to explain it better than perhaps I could. But if anybody has any questions, I'm always here for it, and try to help where I can.
We end our podcast with a few questions that we ask everybody, and you can answer about life, you can answer about cancer biology, you can answer whatever you want. So what is something you know now in your life that you wish you learned earlier?
I wish I knew everything I knew now earlier. But that's obviously not how education works. I mean, that's just the simplest answer that I can think of right off the top of my head. But I guess it's also a testament to the fact that I'm still learning, right? And I'm still acquiring knowledge. And if I'd started with my knowledge that I have now 20, 30 years ago, things would be a lot easier. I'd have some level of time control that I realistically don't have.
What is a non-negotiable, something you have to do every day?
A non-negotiable, something I have to do every day is kiss my wife.
It's a good one.
At least once.
Good. Keep it up, man. It's good. It's important.
My wife is my best friend, and I'd be dead without her. So,
well, we talk about that on this channel a lot, how the importance of touch and remaining connected to your partner is really important.
Your page has helped me a lot in terms of you give a lot of great advice, not even just for relationship stuff, but it can be a little bit embarrassing to talk about, but your page breaks down this barrier associated with some of the, I guess, discomfort to talk about sexual health. So I actually find myself going to your page often to learn more about orgasms and those sorts of things too. And it's quite helpful from my perspective.
Thank you.
You teach me a lot too.
What is maybe a life hack or health hack you would share with us?
My health hack that I find has gotten me through life, that is a bit of a double-edged sword, is being a stubborn son of a bitch. I'm very critical and very skeptical about things, and I don't take lazy answers well. So I'm very good, and I kind of always have been, about knowing when somebody's bullshitting me. So my health hack there is just, trying to be stubborn, but also reasonable. Try
to be convinced before you blindly follow somebody. If you couldn't be a cancer biologist or a marine biologist, because I know you wanted to be that when you were younger, what would you be?
Okay, then the other thing is probably a musician. I play guitar as a hobby in my very limited free time. Yeah, music is a great way to relieve stress. And for me, guitar is something I actually picked up when my mom got sick. It was a great way to kind of dissociate and think about something else. And, for me, when I pick up a guitar, I kind of like to picture musical notes like it's paint on a page. Certain musical notes fit together in a certain sequence and can produce, art in the same way that you'll see a painting. And for me, in my brain, that art is very dynamic when I think about music. It's very pretty. Maybe that was a little bit more abstract, but I love music and I like to think about music even more so.
Well, everyone should have a healthy outlet that allows them to disassociate. I think it's very important. Thank you so much. Where can our audience find you?
First of all, thank you so much for having me on this platform. It's a real honor. I've been looking forward to this for some time. People can find me on Instagram at dr.joe.zundell. People already obviously following you know that my page is there. You've shared a few of my things recently. But it'll also be in the show notes. I have a website, drjoezundell.com. People can go there, find a little bit more about me, and even contact me through that. Even then, people can message me on Instagram through DMs. I'm pretty responsive. As for social media, that's mostly it, because I spend probably more time than I should concocting and perfecting imagery to try and teach people with my cat images on social media alongside an education in cancer biology. So mostly Instagram.
Your imagery is very good. And I will say, since I was just researching your page, I was like, oh, it's really come a long way from when you started. So it's very nice. Well done. Very well done.
I got a subscription to, are you familiar with BioRender?
No.
So a lot of the cell graphics and stuff that I use, there's this company called BioRender, and I swear by it. It's absolutely amazing. So they've got different graphics. It helps me to be artistic in a way and try and simplify things by using images, very specific graphics of biology stuff. It's a really good thing. So that's what's kind of shifted my palette a little bit to be more attractive.
It's excellent. So thank you so much.
You.
And this is wonderful.
Thank you again. I really appreciate this.
Thank you guys so much for joining us on today's episode of the Rena Malik MD podcast. If you guys liked this episode, please do me a favor and share this podcast with your friends and family and leave me a rating or review on Apple Podcasts or Spotify. This helps more listeners find my podcast so they can learn all the amazing content that we put out every single week. And as always, remember to take care of yourself because you're worth it.